Hi, I'm Nancy Burns. I've been an EMT for over 30 years and I care very deeply about people and their health. In this video, we're going to look at the subject of fluoridation. There are still people who question the value and even safety of fluoridation, but decades of research and observation have shown again and again that fluoride is safe and effective. Americans have been benefiting from fluoridation for over 60 years. It really should no longer be considered controversial. First, let's start with what fluoride is and isn't. To quote the American Journal of Public Health, fluoride is not a medication, but rather a nutrient found naturally in some areas, but deficient in others. That's right, fluoride isn't a drug, it's a mineral that occurs naturally in water. Fluoride began being added to water in the United States after the Second World War. Today, nearly 2/3 of Americans drink fluoridated water, and many more benefit from food and drinks that are produced with fluoridated water. Like I said before, to some people, fluoride is still controversial, even though scientists and public health experts have spent decades attempting to educate us about fluoride. These days, of course, the biggest source of information, both good and bad, is the internet.
You can go on the internet and find anything on the internet that will agree with what you think it. And I think you have to have an open mind and go to specific sites. One site would be the CDC, the federal CDC. They have a wonderful website and it's informative, tells you it exists in natural form. It is very well controlled, very well maintained, and you get the biggest bang for your buck, if you will, with it, that more people are reached by public water supply at a safe level for fluoride, and it's just an easy way for dental care.
So lesson 1, get your information from legitimate, responsible sources. When you think about it, oral health is just part of good overall health. Your mouth and your teeth are a part of you and what makes you work. That's a message the medical community has been trying to get out for years.
Fluoride, because of the benefits that we had talked about, both preventive benefits as well as restorative benefits, is really one of the cheapest and most effective ways of maintaining oral health. And I think that it's an important tool to try to combat dental decay, especially among the children in our communities.
Again, oral health is part of your overall health. If you're having dental problems, the associated effects can impact you in so many ways.
If I'm teaching a concept in my classroom and the kid is only thinking about their tooth, or what's going on in their mouth, something's wrong, they're obviously not paying attention to what I have to teach or what they need to do to demonstrate their learning.
The good news is that fluoridation is working. Research has shown again and again that fluoridation reduces tooth decay by about 25%. But even today, children without access to fluoridated water continue to suffer unnecessarily from oral health problems. Many people don't understand that today our whole concept of what normal dental health is very different from what was considered normal just a few generations ago.
When I was growing up with my siblings, we would go to the dentist, and the dental chair was right in the middle of his living room, and we would all wait in the parlor for our turn to go in and have all our cavities drilled with no Novocaine. And now my grandchildren have no cavities at all, and it is because of the fluoride in the water.
The portion of people aged 65 plus losing all of their teeth has dropped by 21% since the early 1960s. Today, just about all toothpaste contains fluoride. And while brushing regularly with fluoride toothpaste is a big part in those improving statistics, the Centers for Disease Control and Prevention and the U.S. Department of Health and Human Services continue to recommend community water fluoridation. That's a major part of our overall efforts to prevent tooth decay. Now, we've given you a lot of information, and we hope you'll do some follow-up on your own. In fact, at the end of this video, we'll give you some places to start. In the opening, we talked about all the misinformation that is out there, and there's a lot of it.
It really does confuse people, because if you let's say you happen to go to Google and just type in fluoridation or water fluoridation, due to various means. One of the first ones that's going to pop up is an anti-fluoridation group, and they've got a lot of somewhat quasi-scientific information they put on there that really confuses the public. And so it's made it much more difficult for us to make sure that people get the real science and the real facts behind this. It becomes a real emotional issue when really it should just be based on science.
Fluoride just makes sense. It makes sense from a medical point of view and from a financial point of view. Fluoridation is one of the most cost-effective health strategies ever devised. Evidence shows that for most cities, every $1 invested in fluoridation saves $38 in unnecessary treatment costs. And it's safe. No reputable study has ever found otherwise. And the bottom line is, it works. We'd like to close with a quote from Dr. David Satcher, who was Surgeon General from 1998 to 2002. He said, "More than 50 years of scientific research has found that people living in communities with fluoridated water have healthier teeth and fewer cavities than those living where the water is not fluoridated." We hope we've answered some of your questions. If you have additional questions about fluoridation, talk to your family dentist, physician, or state or local health department. These web pages from reputable organizations can also provide helpful information. Thanks for watching.